Good afternoon and welcome to the Center for Optimizing Rural Health September webinar. My name is Cassidy Avila and I will be the moderator for the call today. So thank you for joining us for this live Q&A call with experts on hospital marketing, hospital finance, and community engagement for rural hospitals. This strays somewhat from our typical monthly webinars in that we're devoting the entire hour today for your questions. So this is a rare opportunity for you to ask experts in finance, community engagement, and marketing any questions that you might have and get personalized advice and solutions and hopefully solve some of the challenges that you might face in your hospital. So on the call today, we have three very knowledgeable subject matter experts. We have Kayla Klein, a hospital finance expert and clinical professor at the Mays Business School at Texas A&M University. Ms. Klein teaches on the business of healthcare and intermediate financial accounting, as well as international accounting. Her research interests include optimizing surgical care provision and the connection between hospital organizational structure and patient outcomes. We also have Jennifer Chu of McCabe Messaging Partner. Ms. Chu is Vice President and a creative problem solver and communication pro who enjoys developing research-informed communications that consistently reach the right audiences with the right tactics. She has extensive care in communicating a wide range of health topics. We also have with us today Angie Alanis, Director of Healthy Texas Initiatives and Rural Health Access Programs at Texas A&M University. Ms. Alanis has over 20 years of experience working with small and rural communities to identify and address local issues, particularly those related to access to care and the social determinants of health. So at this time, I want to go ahead and get the call started. You have the option to speak your question if you unmute yourself, or type the question into the chat box to the entire group, or you also have the option to type it privately to me, Cassidy Avila, through the chat function. And then I will read them anonymously. So at this time, I would like to unmute all of our panelists and just confirm that we've got everyone on the line. And if you get your questions ready, we will start in just one moment. Jennifer, do we have you with us?
Yes, I'm here.
Perfect. And Kayla, do we have you?
I'm here. Can you guys hear me?
We can hear you. Thank you. I know Kayla has been sick and lost her voice, so you may have to listen closely if you have a question for Kayla. And in the room with me, we have Angie. So we have all three panelists with us. Let me open up the chat. Okay, let's see. I think we actually do have our first question. So the first question says, how many rural hospitals on the call utilize mass email to patients who have signed releases? So that sounds like it's a little bit more pointed towards the audience than one of our panelists. So if anyone would like to, I might be able to copy and paste that back into the chat and send it out publicly. And then if anyone wants to just respond to that, the individual that sent it could see your responses. Okay, so that just went up in the chat. So if anyone wants to respond to that individual, she will see your responses. Let's see. Oh, okay, I'm sorry. So a follow-up to that, can the panelists comment on its usefulness? So how useful is it to have mass email to patients who have signed releases? So Jennifer, that might be a question for you.
Yeah, sure, sounds like it. All right, I would say my answer to that would be a couple of follow-up questions. I think you want to ask yourself why you're emailing your patients, what your ask of them might be, and that can help determine how useful it is. It sounds like it's ideas, signing releases. It sounds like perhaps you might be looking to capture some stories or experiences or testimonials of patients and their experiences with your hospital, and getting those personal stories and having patients talk about their positive experiences is very valuable. That's content that you might be able to use on your hospital website or in other forms of marketing. But I think before you email your patients en masse, the question to ask is, what is the goal of this particular communications tactic. The nice thing about mass email like that, especially if you use a service like MailChimp, which is free, is that it offers you a lot of metrics and an ability to just track and be able to report on how you're doing and kind of measure how your mini campaign is doing. So we would say that if you're planning to email even more than like 20 people, to check out the MailChimp free features. You can design a very easy and simple template that looks nice and elegant, and then put out your mass emails, and then it helps you track, like, are people opening it? Are people looking at it? Are people opening it and then not doing anything? Or, you know, who's opening it and clicking it? Those are all good metrics to look at and check.
Great, thanks, Jennifer. And that audience member followed up and said that they're hoping to promote new physicians at the hospital with mass email.
Oh, great. All right. Well, it sounds like maybe you want to start a newsletter. And I would encourage you then to expand your audience beyond just your former patients. You may want to put a, sign up for newsletter updates email box on your website, and then you can also include, that way other people who aren't necessarily just patients are joining. And I think it's a great idea to have a newsletter, provided that there is the resources and the capability to keep it going regularly. And by regularly, we don't mean you have to send something out every week, but if you know you have the capacity and the content to send something out on the first of the month or the last Friday of the month, but do that every month. Picking a regular interval is what's most important, because then you're training your audience to look for something from you on a regular basis. I think we probably all have similar experiences when we think about the marketing emails that we sign up for in our personal lives, and sort of that repetition and steadiness is what we're counting on. So it's a great way to promote news from the hospital, to promote new offerings, to promote events or community events. It's a great tool. I would just advise you to do it on a regular basis. And monthly is a good place to start. Quarterly is another good interval to use. And again, you can use something like MailChimp, or if you have a lot of email addresses and a lot of contacts, and you have a little bit of funding, you could try using Constant Contact, which is just a little bit more expensive than MailChimp. MailChimp is free, but Constant Contact also has very robust metrics as well. We use both.
Great, thank you, Jennifer. And someone had responded on the chat to say only on the patient portal. So they're only sending out mass emails on the patient portal, which would mean to former patients. And I think I heard you say that you might consider expanding beyond former patients with, a sign up for our newsletter on our website link. So that's a great idea. Let's see if we have any follow-up questions to that. Okay, I don't think so. So we'll move on to the next question. This question is from Ms. Klein. Can you speak to solutions that you have offered small hospitals for increasing their revenue? Kayla?
Hi, yeah. Yes. You guys, okay. All right, yeah. So So I think revenue is really a big question for a lot of rural hospitals, how to bring in enough revenues and how to negotiate with insurers to be able to make sure that you're being paid a reasonable amount for the services that you're providing. So some things that I've talked to people about and heard about doing, some really, honestly, the thing that I think would probably move the dial the most would be figuring out strategies to work with insurers to make sure that you're being reimbursed fairly. And I know that that's really tricky when you don't really have the bargaining power that a large hospital has. And so that's where I would say, to the extent that it's legal and possible, I think you need to talk to your peers, come up with some peer networks. I know that's something that Archie's doing to figure out what other hospitals are being reimbursed, so that you can figure out kind of what your targets are for different, for some of your key procedures or things that you're doing a lot of. I think that's, from what I've seen, that's going to move the dial the most. If you can come up with a pricing strategy, so making sure your charge master is up to date, doing some kind of charge master review. I say this on every call that I'm on, but Stroudwater is a consultant that specializes in working with rural critical access hospitals and community hospitals. and they have programs specifically designed to work with Flex grants. And so if you do have the money to do, they do kind of assessments and charge master reviews and things like that, and they're very reputable, and they specialize in rural hospitals, and so they are able to really help in ways that are meaningful. So that would be one thing I would do is just if you can have someone look at your pricing strategy, look at your kind of contract negotiations with insurers in your particular market and in your unique context. It's kind of a hard question to answer because every market is different, and every hospital has different relationships with insurers and different insurers that they're working with. And so I would not say that there's one blanket solution, but I would say first things first, you've got to do some kind of revenue cycle review. You got to make sure that you're not missing revenue. So a lot of hospitals, there's a lot of inconsistency in charges that are billed for the same procedure. And so something that you could do before you go into a charge master review or one of these big things is pull, 10 procedures, the codes for 10 procedures that are supposed to be similar, and see if they really are similar. Are you actually charging for what you're supposed to be charging for? I would say that's a cheap, easy, free way to start, and just look at it and see if you have consistent coding on procedures. That's kind of low-hanging fruit. If you figure out how to do that more consistently, if you can set up systems, put those in place for your business office to be able to code those things more accurately, and that could actually make a pretty big difference depending on the situation your individual hospital is in. So that would be my first and foremost thing. If you can't afford the consulting to do something like that, do an internal review. I would also say, just kind of zooming out a little bit, big picture, you need to think about what services your market really requires, especially for rural hospitals. That's kind of tricky to figure out what your community needs, but through your critical access, you do have to do a community health assessment. I know there's a lot of needs for mental health, and I know that's hard to staff, and that can be tricky, but meeting that need and finding a way to monetize that, if you've got extra facility space, could be something to look into, because it's really important for the overall health of your population, and can really meet a need. And so if you can figure out a way to use your space and your capacity to meet that need and kind of monetize that, I always encourage people to look that direction, because there are very few communities that don't have some kind of need for mental health. So that's another area to consider. If you're close to a larger, like an urban center, we have talked to a few hospitals that the urban centers that are nearby are kind of over capacity. And so one hospital we worked with used an OR for pediatric dental procedures. And so they would kind of lease that space out that they weren't using. And pediatric dentists would come out and do procedures in the ER. And it was actually a win for everyone. It was kind of like a calmer environment, and the kids did better. They were able to use that space. It wasn't crowded. It wasn't stressful. So those are some things. Just try to think outside the box of meeting needs in your community, and even the community around you, the larger community, to try to identify some ways to help out and improve population health and monetize that and make that more, a way to bring some revenue into your hospital.
That's excellent, Kayla. Thank you. And if anyone wants to follow up on that or comments on any kind of excess space that they lease out, we would love to hear from you in the chat. So until then, we'll move on to the next question. Looks like this is for Angie. Can you offer any tips or tricks of the trade when conducting a community health assessment that a rural hospital may find useful?
Sure. So as I believe our audience probably knows, all nonprofit hospitals, as a result of the Affordable Care Act, do have to conduct community health needs assessments every 3 years. And so there's a lot of resources online, and of course we can provide you with additional resources for managing a community health needs assessment, including the RHI Hub, that's the Rural Health Information Hub, has quite a few resources in conducting those needs assessments, as well as CDC and I believe it's the Association of Community Hospitals that also has information online on just the needs assessment process itself. Typically, hospitals will engage a consultant to help manage the assessment process, but the hospital, particularly in rural communities, can do a great deal of the lead work on their own to ensure that they're getting active community participation in the assessment process. This is also what we have found to be a really good way to initially engage your community in what you're doing at the hospital if you're not already doing that. So a lot of times when we work with hospitals, when I've worked with hospital systems in the past to conduct needs assessments, we will start from the very beginning of that process, engaging the community in really the design of the assessment. So if we're acting as a consultant, we will work with the hospital and ask that community members participate in the design of the assessment process. So for instance, if we're going to conduct a survey, we want those individuals from the community to come in and talk to us about perhaps the best way to approach folks in asking them to participate in the survey. A lot of times when we do assessments, we will hold what we call community discussion groups. And so we'll ask for insight from key community stakeholders as to how to engage the community in those focus groups. So where should we have the focus group? Who should we invite? What time of day should we have that? So again, you're getting the community involved in this needs assessment process. And we found it extremely helpful, like I said, to engage the community early and often throughout that process. One, they understand what you're trying to do, the information you're trying to gather, but as you are collecting the information, the data from that process, you also want to include them at least in an initial draft report review, because again, what you want them to do is confirm that what you're hearing, even if it's a consultant that's pulling this information together, that it's accurate, that it represents most of the community, because you always have an opportunity at that point when it's in draft format to say, you know what, we didn't hear from this group, maybe you should go hold another discussion group, or maybe we would like feedback from this particular segment of the population on what we found to get a little bit more context. So I always think it's helpful to have that community group, a community group working with you in partnership as you're going through that process. And then finally, what you want to be able to do is disseminate that information amongst your community. You don't just keep it, for yourself or checking the box for your IRS requirements, right? You want to be able to get that information back to the community and say, this is what we heard from you. So you may do that at a health forum, specifically around the assessment. You may want to work with that group of community advisors that you've been working with throughout this process to say, we want to get this in front of as many people as possible. And in a rural community, a lot of times, you may only have a weekly newspaper, or you may not even have what you would consider a local television station to report the findings in a news broadcast. So what you might want to do is look for opportunities to go talk to civic organizations like a Lions Club or a Rotary Club, or go to the private sector by presenting at the Chamber of Commerce monthly meeting. Another opportunity is speaking to parents, maybe through PTO meetings on a regular basis. So that's one thing we do. And then finally, what you want to do is not just conduct this assessment and put it on the shelf. And there is a requirement to do a community health improvement plan as a follow-up to that assessment. And so you can then continue to engage your community group through that process as well. So you have your community stakeholders, your leaders, kind of your gatekeepers for the population to be sitting with you and actively participating in this process, so they see what you are doing, as that second step to the assessment process. And again, by engaging a community, then they're able to disseminate through word of mouth. Oh, we've participated in this assessment process. This is what we found. And now the hospital, based on the recommendations of the community, is going to address the top 3 priorities. So I think there's a lot of opportunity to engage the community throughout the process, the assessment and the community health improvement planning. And then on an annual basis or a quarterly basis in coming together to listen to the status updates of that health improvement plan, or maybe even engaging them in some of your health improvement strategies.
Great, thank you. And we actually have another question for you, Angie, that came in through the chat privately. As far as community needs and outreach, we know we have certain needs, but the community lacks the resources to direct people to them. How do we make an impact on some of those needs? For example, obesity, mental health, et cetera. Any tips?
Yes, so that's a pretty broad question. And I'm assuming that you're looking for ways to refer people to resources. You may, if you don't mind clarifying the question, but I will answer to what I think you're asking. A lot of times, particularly in smaller communities, those resources aren't available in that community. You may have to travel a distance. So one of the things that we've done with both hospitals and social services organizations working in conjunction with hospitals is to come up with an information and referral process, and kind of a no wrong door approach, so that we develop this information, where to access those resources, how to access those resources, and sometimes develop solutions to actually physically help people access these resources. So whether that's developing a transportation system or developing a comprehensive case management approach, to where an individual can come into a hospital or a social services organization or your public health department, and there's some individual that can help navigate towards those services. We've come up with those types of solutions, working with a group of community leaders from each of those sectors. So if that's a question that you're asking, that's one way that we do that. Another way that we try to address these needs is working with the actual resource holders or providers of these services that may be regional providers, so not located in the community, but have those folks come and work with the community to determine how to provide those services in that particular community. We've worked with several different communities, rural communities, to try to bring some services in, particularly mental health care. One of the solutions that we looked at and implemented was a telehealth solution for behavioral health counseling. We actually had an opportunity to work with Texas A&M and their educational psychology program to determine how we could utilize doctoral students who needed that practical experience to provide counseling in the rural communities, and the best fit was telehealth, and we were able to secure both local funds and grant funding to make that happen. We've also worked with other organizations that have said, we would like to be able to provide these services locally, but as a regional provider, we can only afford to be located in the regional hub, if you will, and people have to come to us. So one of the things that we've done is work with communities to identify space, so that if a provider was able to come maybe to that community once a month or once a week, that they would have space to come to that really only cost them, some gasoline time to get there, and then some personnel time to be able to provide services directly. So that's another way that we've done that. And I'm hoping I'm answering your question. So if you have a follow-up, let me know.
Okay, we don't have a follow-up yet, so hopefully that was exactly what she was asking. Okay, so that's an excellent response, though. So we have another question for Kayla. Kayla, a financial question. How many days cash on hand do you recommend, or would you consider the minimum for a financially healthy hospital?
Yeah, that is also a really great question, and I think it's a little bit of a tough one. I know what I will say right off the bat is that most of the hospitals that we talk with who are in significant financial distress, days cash on hand is one of the first things they talk about. So that it's a red flag that if you're struggling with days cash on hand, you're kind of you've got big problems. So we also, just to make you feel, just to kind of know where we've talked to hospitals that have measured days cash in hand in hours. So this is really tough. What I do know about days cash on hand for critical access hospitals, the last time I looked, there was a measure in 2016, and the median days cash on hand for a critical access hospital was about 77 days cash on hand, according to what I've seen. So that's median, right in the middle. And so I would say that's probably a good target to be somewhere right in the middle. Too much cash on hand, and maybe you're not using your cash wisely enough. And obviously, if you don't have enough cash on hand, you're kind of in hot water, and you need to figure out how to fix that, which is easier said than done. But yeah, I'd say the median is 77, and I think that anywhere maybe in the 70s, I would say would be a good target.
Great, thank you. Jennifer, we have a question for you over at McCabe. Our Facebook page doesn't get a lot of attention. Do you have suggestions for increasing traffic or recommendations of what we should be posting and how often we should post?
Sure. I guess the question is what you want to use your Facebook page for. If it's a way to build community and share some of the behind the scenes or announcements coming from the hospital. I think that with the way that Facebook algorithms work, posting constantly is in your favor. And by that I mean you probably want to aim for daily right now. If you're able to do a couple days where you post more than once a day, that would probably be helpful. Facebook does well with shorter posts. It does well with things like events, as well as single photos versus photo albums. So some examples where we've seen clients be really successful on Facebook is, sharing, for instance, having a provider do kind of a day in the life where they share their day in the life at the hospital and share a couple of photos throughout the day of what they're doing, promoting specific events, and promoting it more than once. So if you have a health fair on Saturday, September 28th, you probably want to schedule like 5 or 6 Facebook posts leading up to it to promote it and change up your copy and change up your images so that people see something different and go there. Increasingly, we're seeing it hard to kind of build an audience on Facebook if they're not already there. So it may be worth just informally polling friends and family or hospital employees just to see if people are still using and still on Facebook. I know that there are sort of demographic trends as to who's using it. There probably are some geographic trends as well in terms of who's actively using it. You may find that if people aren't using it, if it's just not a popular destination, then maybe you don't need a Facebook page. I think there's a common myth that everyone thinks everyone should be doing some form of social media. So everyone has a Facebook page and a Twitter account and an Instagram account, and often find that they don't need that because their audiences aren't there and aren't using it.
Great, and we have a follow-up that's kind of along the same lines. It says, can you talk a little bit about how to market to the older generation who may not be on social media? Should we be marketing to their children who may be in charge of their care, or trying to reach them in another way?
That's a great question. We work with a lot of clients who do work with older audiences and sort of are targeting seniors. And I think it depends on your community, and you may want to do it both ways. I think that in-person contact and sort of in-community events still tend to be very effective ways to reach older adults. Especially when they're held during, a weekday afternoon, for instance, or a breakfast event. Those seem to be still great ways to reach older adults in the community. Or places like community gardens or the library or even the local store or post office are all ways to get some printed materials in front of them. On that note, I say printed materials because I think there is still a tendency amongst older adults to want to use and see something that they can touch. So whether it is a postcard or flyer, something that they can look at, see, and then put up on their fridge or have in their home lasts a lot longer than necessarily using social media or email or anything on the web. So I would suggest that you have printed marketing pieces. And then in terms of reaching their adult children who might be responsible for their care, again, that's looking at where that age range might be. And I'm guessing you're looking at maybe late 40s, early 50s, and what forms of media they're using. I think that radio and local TV is still very popular amongst all audiences. And then depending on your local media market, you may want to see if your local radio station runs any kind of public service announcements. And those would be quick advertisements that you don't have to pay for, but you provide a line or two for the radio host to just say about your hospital. Similar to TV, you may, if there are local stations who do local segments on health, it may be worth calling to see if they need a local expert and position your hospital as that health expert who can speak on a number of topics. And that gives you some additional visibility into that channel. If you are using social media and you're using it successfully, and by that I mean that there's someone at the hospital who is skilled and who is using it and who's posting it, and it's not something that's just an afterthought or whoever has time to posts, that could be a good way to try to reach those adult children. If you have some resources behind that, you could look into social media advertising. Facebook advertising is very, very cost effective. You can run a campaign for less than $100. And what's so nice about it, at the same time, it's a little bit, people get concerned, but because Facebook is really good at targeting. They're very good at geo-targeting. They're very good at saying, you can tell it, I'm trying to find people who live within a certain radius of this zip code, who might be in this age range, whose interests might include gardening, for example. And they will try to find those people and show your ads to them. So in that sense, it is very much reaching the audience you need to reach, but it is, it's quite targeted.
Yeah, those are some excellent tips, Jennifer. Thank you. We have a question for Angie, and I think you kind of touched on this earlier, Angie, but the question is there a specific toolkit that you can recommend if we're doing an in-house needs assessment?
Yes, so as I said, there are several. I think one of the most comprehensive ones is the Association for Community Health Improvement. It does go into a lot of detail around data collection. I think it's a good toolkit to give you some background information, maybe a little bit more than what you need if you're doing it in-house. I will tell you, we've worked with hospital systems also that have chosen to, for instance, find their own secondary or existing data. And so what we will do is we will point them towards that data. A lot of times, one of the best resources you can go to is the Robert Wood Johnson County Health Rankings, and I believe it's just countyhealthrankings.org. That gives you a good foundation for a lot of data related to quality of life, health outcomes, which is, you will find some of those quality of life data in that, and then as well in health factors. So that gives you kind of a broad brushstroke of your community. Then what you want to do in addition to that, and I mentioned it before, is hold actual discussions with your community because it provides you with some context for that data that you're looking at. So, for instance, one of the communities that a colleague of mine was working in years ago had conducted a community assessment about 4 years since the first one they had done, and there was this huge spike in chronic diseases, and they couldn't figure out why until they had a discussion with the city manager and the mayor and some other folks, I believe, at the chamber, and they said, oh, well, we've just built this retirement community and we've had this influx of population. Well, that can kind of give you some sense of understanding why you had a spike in chronic disease, because most older folks have more chronic diseases. So I think it's always important to have that other piece of the assessment, that qualitative piece, if you will, to provide that context to the data. So you can do it by yourself. There is that toolkit. Again, it is on the Association for Community Health Improvement, and that is healthycommunities.org, and you'll go to their resources tab. Also, the CDC has some guidance on community health assessment and health improvement planning, and that will be part of their public health professionals gateway section. So you can actually just go to CDC and search for community health assessment. Also, the National Association of County and City Health Officials has a toolkit that is, I think, pretty user-friendly as well. So those are three options. There are others, and we can send that around after the webinar.
Angie, is it common for hospitals to conduct an in-house needs assessment, or do you recommend hiring a consultant?
I would recommend, if you can, to hire a consultant. And again, you might be able to have some cost efficiencies if there's a nearby hospital nonprofit that also has to conduct a community needs assessment, and maybe there's some overlap with your target population. You may be able to save some dollars there when you're conducting a health assessment. Other times, you may be close to a university that has a school of public health. A lot of times, they will have faculty members, and particularly doctoral or graduate students that want to be involved in conducting community health assessments. So you can usually partner with schools as well. You can do it by yourself, and again, there's the guidance, the IRS guidelines does indicate what you have to include in that community assessment. So you can do it yourself, and as I said, there are existing data that you can access. In addition to the county health rankings, you can usually go to your state health department and access data. And it depends, again, where you live as to what level, if that's a county level or a community level or zip code level. And then again, you can conduct focus groups to provide some context to that, and I would look at the toolkits to provide you with that.
Great, and we can definitely share those resources and links after the webinar for anyone that's interested. Okay, so let's go back to the chat and see what questions we still have. Kayla, another financial question. Is global budgeting a viable approach for critical access hospitals in very rural areas who may already have few admissions? So,
global budgeting is, so if you're not familiar with the concept, the kind of basic idea, this is an experiment that CMS is doing right now. It's been going in Maryland for a while, and it's been successful, and they just implemented a pilot in Pennsylvania. And the idea behind global budgeting is payers coming together and coming up with a fixed budget for a given hospital for a given year. So instead of basically it just kind of eliminates variation in revenue. So a hospital knows how much revenue they're going to have to work with in a given year. And the reason to do that is it kind of eliminates some of the game playing with cost reports, and just helps hospitals to know, all right, these are the services we need to provide, and this is how much money we have to do it in a given year. So the goal is to help hospitals work on population health and provide the services they need, and not have the kind of revenue uncertainty that they have now that kind of can be kind of paralyzing. So that is what global budgeting is, and it's really new. It worked well in Maryland. It's been successful, but Maryland has kind of a unique rate-setting healthcare authority. So this Pennsylvania trial will be interesting. They're going to do, I think they have 5 or 6 hospitals signed up, and 30 are targeted. And there's a little bit more to it, but they're doing the experiment there, and I think that'll probably be a better test of if this is something that's kind of viable for the long term. But the goal is to be helpful, and so yeah, so I think that it is a potentially good and a good option for critical access hospitals going forward. Yeah.
Great, that'll be interesting to watch. Okay, next in the queue, Jennifer, this is a question for you again. We have recently added a new service line, dialysis. What is the most effective way to promote this service?
That's a great question. It sounds like for dialysis, not being an expert in the area of dialysis, I'm going to speak from a marketing communications perspective. So it seems like marketing that new service, thinking about whether it is necessarily just for patients or if reaching some sort of gatekeeper or influencer like a social worker or some other form of health professional who can refer patients to your services might be helpful as well. Since it sounds like it is not necessarily targeted, you may want to consider broader community advertising just to get the word out that the new service line is available. And depending on what's available in your community, that could be a combination of newspaper ads or radio ads, or if there is sort of public transportation, having transit ads outside in the open is very effective as well. Perhaps having a dedicated point of contact for it, so that if someone calls the hospital or if someone is interested in it, they're triaged or routed to one person who could help them connect them to the services better would be really useful as well. Here's also where an email campaign might be useful if you already have a database of email addresses, and just letting everyone know that this new service is being offered, and also encouraging people to tell others. Word of mouth can be really effective and really useful as well.
Great, thank you, Jennifer. Well, it looks like those are all the questions that we have in the queue at this time. So we still have about 15 minutes. If anyone wants to ask a question, you can unmute yourself and verbally ask that question, or you can type it into the chat box to myself, Cassidy Avila, or to the group by selecting everyone in the drop-down box. So we'll just kind of hang tight for a minute and see if any other questions come up. While we wait, I do want to go ahead and plug our website, optimizingruralhealth.org, and the slide is up now. We've been rotating slides, but you can see that our Year 2 application portal is open, and it will be open through October the 31st. So if you're interested in applying, even if you applied last year or you were in the program last year, you're still able to apply again in Year 2. So you can check out our website, or you can give us a call or shoot us an email for more information, and we would be happy to talk to you about eligibility and who is able to apply or be accepted. We also have some really good FAQs about CORE, what we do, what kind of technical assistance we provide, as well as the application on our website. So you can check all of that out at optimizingruralhealth.org. We'll also be at a couple of upcoming conferences, as you can see on the screen, the Critical Access Hospital Conference in September in Kansas City, as well as NoSOAR in October in Albuquerque. So look for us there if you guys happen to be at either of those conferences. Okay, well, we still don't have any questions in the queue, so I guess we'll go ahead and wrap up early. Yeah, I just wanted to give everyone a chance to ask any questions that they might have. It's a really good opportunity. You may not get this one-on-one time with these experts again, so it's a great chance to ask any questions that you might have on the top of your mind. If you have follow-up questions, you can absolutely email those to us, and we'll do our best to hopefully be able to get a response back to you if you think of something after the call. But we want to thank you for joining the call today, and a huge thank you to our panelists for your time and the great conversation and solutions that you offered and contributed today. So check out the application, check out our website, and if you would like to view this webinar again for any additional information, you can certainly find it on our website. It'll post in a couple of days. We also have a YouTube channel. You can follow us on Facebook and Instagram. Oh, no, I'm sorry. We're on Twitter, not Instagram. And see what we're up to there. And look for an email from us in a couple of days. There will be a quick 60-second survey just to let us know what you liked, what you didn't like, or what you would like to see again, whether you found this beneficial or you would like to continue doing the traditional webinars, we're interested in all of that information. So that email will be coming to you this week. But again, thank you for joining us. Have a great afternoon. Bye, everyone.